is okay. Hey, you know, thousands of children each year are born with clefts of the lip and palate, other conditions to the head and face. This month is National Cleft and Craniofacial Awareness Month. How about that? I got that out without a problem.
Excellent.
This is Dr. Michael Jaskolka, who's the Director of Children's Surgery at New Hanover Regional Medical Center. You may not realize this, I've never said it, but this affects me close to home. I've got two uvulas back there because I have a split palate. When I was a kid, every time I went to the doctor, everyone would say, "You're a very lucky young man." This is very common, or more common than people think.
Yeah. So you probably have what's called a submucous cleft palate,
okay,
where the range of severity of cleft palate is quite wide, and it is not always a functional problem. Obviously, your speech is quite appropriate for
what I do for a living, anyway.
But that runs on a wide severity to a complete cleft of the palate, where there's an opening between the entire mouth and the nose.
And a lot of people see this, unfortunately, when they're watching television in the middle of the night, where they're asking you to send a few dollars to be able to help children overseas correct this problem. But this is a problem that affects people here at home, obviously. What can people do?
So the prevention is basically focused on maternal health and nutrition. There continues to be studies on the cause of cleft lip palate and other craniofacial conditions, and other than some of the conditions that run in families, nutrition and maternal health are really the main focuses.
And so when a child has this condition, the treatment has changed dramatically over the years as well.
Yeah, I think it's, we really focus on a very conservative and timeful approach. And these are not guidelines that I've made up, but there are some pretty good general guidelines that when the cleft lip is best repaired, when the cleft palate is repaired, and it's very much a balance between speech, hearing, growth, ear function, dental function. It's really the reason why there's such a need to bring so many subspecialists together to care for all these children in one time.
Because you could have sinus issues, hearing issues, and it's all one big puzzle up there in the head, right?
Absolutely.
And the great thing about that now is kids don't have to go to Raleigh or Winston-Salem to be able to be treated. They can do that right here at home.
Yeah, so the Cleft and Craniofacial team has been slowly evolving over the last several years, and has really taken off and continued to grow over the last three. The American Cleft and Craniofacial Association has recognized the team at New Hanover Regional Medical Center for just the standards of care that we follow, and it's been a great, it's really been a great group between the community, the hospital, and a bunch of volunteer providers.
And so a lot of parents or patients at home now realize they have that option, which is a good thing. All right, doctor, thank you very much for being with us. We appreciate it.
Thank you. I appreciate it.
You know, many